All right, so Lillie, as a performance specialist, I know you have a very strong fitness practice, but you still felt the need to go see Dr. Kate. And what prompted you to go see her?
Yeah, so even though Pilates has been really helpful to my overall well-being, I have some chronic pain left over from old injuries in my neck and shoulders that just tends to get tight every once in a while. So for me, physical therapy is just part of my overall well-being maintenance program. And I've noticed that when I get PT, it really frees up my Pilates practice so I can get more out of it.
Great.
Awesome.
And Kate, now when Lillie came to you, were there certain things that you observed that you wanted to focus on? And also, what techniques did you use?
Yeah, so Lillie was very strong. She is very strong. She's very active.
Yeah.
But I did notice that she still has some tension in her head, neck, and shoulders. And so I've been trying to help her out by doing some dry needling, lots of dry needling, which Lillie loves. And then I've actually done some laser therapy where I had attach a headlamp laser to her head and she does some mazes and some fun activities.
It's
with
very
that.
cool.
Awesome. Makes me want to try it. Now, Lillie, you have taught Kate some Pilates. Now, Kate, you already have a fitness practice and already a lot of information about the body. What interested you in going to see Lillie for Pilates?
So I do a lot of strength training. I do a lot of cardio. I spin a ton, but I felt like I was missing sort of a deeper connection to my core and my breathing when it came to strength training, and Pilates is a really good way to incorporate that, and I know Lillie does a really good job at incorporating all of that in her Pilates practice, so I thought it would be very beneficial, and it has been.
And then, Lillie, is there anything that you noticed in particular about Kate, or pieces of equipment or certain exercises you wanted to do with her?
Yeah, I think even though Dr. Kate has a really great understanding of anatomy in the body, it's always helpful to have someone else's eyes on you and hands on you. So we worked a lot on exercises for the upper back for improving posture because it's hard to bend over people all day long, and really activating that deep breathing to get deeper core activation, to get overall strength. And as we all know, the core is the best support for the back. So happy core is happy back. So we worked on some of those
100%.
things. Yeah.
And then one thing I'm going to fire at you. I know in my experience working with physical therapists, I feel like we learn a lot from each other. And I don't know if you had some experience with that, or are there certain things you felt like you learned even outside of just the treatment itself about the body or about movement or about how to talk about movement?
Well, Kate and I have talked a lot about the lower back, and I have learned a lot about how the lower back can heal and how to work with it, and how Pilates can support the healing process after someone's done physical therapy. So that was kind of new to me, really realizing how much the lower back can heal itself and how supportive Pilates is for it. Even though I knew Pilates was great, I think Kate gave me even a deeper understanding of that, which was cool.
Yeah, I tell all of my clients and patients that Pilates is actually the best thing for low back pain, so I'm almost always referring anyone that has low back pain to any of our Pilates performance specialists.
So, and it sounds like, Kate, you might see someone, Dr. Kate, you might see someone who might have a specific injury, whether it's chronic or a sudden onset, and help them with that. And then, Lillie, you would help someone with their strength and core and mobility and Pilates. So, would you say also, Lillie, you might have a little more anatomy knowledge now after working with
Yeah.
some smart person like Dr. Kate?
Definitely.
You're pretty smart to start with, but I try to help.
So I think what we'll do in our next video is show some of the techniques that Dr. Kate has used that have helped Lillie, and show some of the exercises that Lillie has done that has helped Dr. Kate. All right, thank you
Sounds
guys so
good.
much.